Is it across all platforms, Alex? We're on now. All right, we had a bit of a technical glitch. I don't know how much you were able to hear off the top. Do you know if I need to repeat the introduction? All right. So I'm going to welcome you again. Sorry for those of you who had audio, who weren't able to hear us off the top, but this is, we're gathered here today for a Facebook Live, and we're on several other platforms as well. I'll list those in a minute, to speak to you about what you should consider if you're trying to decide if you should travel or not internationally. WHO has a mandate to help people understand, help countries understand what the risks are relative to international travel, and that's what we'll speak with you about today. My name is Nika Alexander. I'm with the media relations team, the communications team here at WHO, and I have two people with me to talk with you about this subject. One is Dr. Nedret Emirolu. She heads the group that looks at country readiness, how countries prepare to manage emergencies, and also Dr. Carmen Dolea at the far end, who's the head of the IHR Secretariat. IHR is International Health Regulations. It's one of two global mandates, global agreements about health, and it's what gives WHO a lot of its marching orders, what we should do around emergencies and around travel and trade as well. So today we're 7 months into this outbreak. We're 6 months since WHO declared this a global emergency, a public health emergency of international concern. Some countries, the situation is getting worse. Some countries it's stabilized, and in others it's gotten better. And people are starting to think about whether or not they can make a choice to travel. So to talk about that, I'll turn first to Carmen. Carmen, I said off the top that this is about choices, that it's not, there's no mandate that people must move around, although sometimes people have personal mandates that they need to move around. So what's the first thing people need to think about when they're contemplating whether or not they should undertake an international travel voyage?
Thanks very much, Nika, and hello, good afternoon, everyone. The first thing to know is that sick people and people that are contacts of a confirmed case of COVID should not travel. That's one thing. The other thing is people that are elderly or have underlying health conditions, they should postpone travel, particularly in areas with intense community transmission. We also defined in our recent guidelines what it means of essential travel, because with all these restrictions, there must continue some essential travel for humanitarian and emergency response, for cargo operations, diplomats, seafarers, and a group of people that are really have to travel. Even for people that choose to travel, there are certain precautions that people should continue to take while traveling. First of all, the precautions for a respiratory transmitted virus. Make sure that you keep your distance, make sure that you practice coughing etiquette, you cough into your elbow or your sneeze or in a tissue that you dispose of. Wear a mask, particularly in areas where there's crowded situations, and follow the instructions or the measures that are in place by the national authorities when you decide to travel. And then people need to make their own decisions, looking at what would be their exposure in the areas where they want to travel, what would be the intensity of exposure, what's the transmission patterns in the area where they travel, what is the duration of potential contacts with people that may be sick, and what are the measures that they can do to continue to protect themselves.
Okay.
I don't know if Nedret wants to
jump in.
Yeah.
That's actually a lot of information
Yeah.
to digest.
Exactly.
We're going to piece it up a little bit. We will chunk it out, and that's the broad scope of what we'll be talking about today. So just to chunk that out a little bit, one of the first things you said off the top is that if somebody is elderly, they should not travel. How do you define what's elderly? I think people might be surprised when you give the actual number, the age.
Nika, maybe I should start with the first steps. It's the same approach as we suggest to control the epidemic at the local level. So the risk assessment and risk management. And that's the kind of information we would like the individuals to carefully assess their situation. Do you need to travel? Do you take the risk if there's a risk to travel? What is your own conditions? What is the epidemiology in the country that you are living or you are currently, and where you are going? What is an essential WHO advice is to protect the high-risk groups. And those high-risk groups are the same as within the transmission that we define. over 65 years of age, unless the country defines it differently. And then anyone with the underlying conditions, which we know already, diabetes, cancer, chronic conditions, some of the chronic diseases that they should be protected as highest level of risks, and then they should consider to avoid or to postpone their travel. But of course, at the end, if they really need to travel, that will be their own risk assessment and judgment. So in a way, it depends on where you're going from and
Yes.
where you're going to.
And who you are, what your
And who
situation
you are,
is.
exactly.
Yeah. So at the top as well, you said if you're a contact, of course, if you're sick, you should not travel. That seems a very common sense one. And if you're the contact of someone, the way you would know if you're a contact in some countries, you would be in a contact tracing sort of environment. Their health officials would be following up with you. You would know that you have been in contact with someone who is a confirmed case. So that's a way of knowing that you are a contact. In some other places, it might not be as clear to know whether or not you're a contact, but that's the guidance anyways. If you are a contact, you should also not travel. We spoke about the choice of whether or not to travel. Let's say you must undertake some essential travel, or you're one of those essential workers. What's some of the measures you should think about as you're heading first to the airport or the train station where you will undertake that travel from? What can you do to protect yourself while you're in that first hub in your voyage? I would like to do that one, Carmen.
Okay, so I can start again. So planning your journey, you'd either have to go to the airport in a public transport or in your own car and so on and so forth. Protect yourself even in the public transport. In some places, you need to wear a mask to protect yourself and protect others. Use hand sanitizer if you need to, or wash your hands properly. When you arrive at the airport, there are many airports now that begin to open for travel, and they have put in place measures particularly to support the resumption of travel, which means distancing, physical distancing when you go to the check-in, when you go to the security areas. In some airports, you are required to wear a mask as you go through the security or you go through the check-in. Airports and airlines favor online check-in or limiting the contact with the ground crew, so that limiting the exposure, the potential exposure. And all these measures that you'd see, signage in the airport that tells you where to go, how to keep the distance, how to make sure that you're not in contact with people. And really, all of these measures that we keep saying of physical distancing, increase the number of stations for hand sanitizer, or increase the disinfection at the airports and all of the areas, particularly in the contact with the ground crew, all to the point where you embark. And even on embarkation and disembarkation, there are measures now to stagger the onboarding and the disembarkation, so that we keep the physical distancing that protects people going on a travel, so that we can resume safely.
Thank you.
I think Carmen really covered comprehensively, but as a summary, my message is do what you always do to prevent from getting infected. I mean, it's the same thing
There's nothing special about travel in a way.
But do it all. Do not do one and only. I mean, hygiene and hand washing, looking into the physical distance. If you're in a crowded place, and if possible, using a mask or a face covering, and trying to really keep away from the population, the crowd. So those are all the general principles we have been giving over and over, where like Mike has been really, or Maria has been telling that continuously during the press briefings, and that's always the WHO message.
Yeah, it's almost a hashtag do it all kind of idea, that there's a menu of things that are important to do that will protect you. Now you mentioned masks, and I know when we do our press conferences, sometimes people in the comments ask us, why aren't we wearing masks? Might even ask us now why we're not wearing masks. We're practicing the first thing in that list of do it all, which is the physical distancing. We're over a meter apart, and that's WHO's advice, where possible, to stay at least a meter apart from other people. And if it's not possible, as Carmen mentioned over the top, if you're closer because you're in a close setting, then you'd be advised to wear a cloth face covering or a medical mask if you are somebody in the at-risk group that we mentioned off the top. So we are on LinkedIn, Facebook, TikTok, Twitter, and YouTube at the moment. If you have questions for us, because that's the point of one of these live events, if you have questions for us on Twitter, you use hashtag AskWHO, ASKWHO. That's how you give us your questions on Twitter. Otherwise, put your questions in the comment section, and we have several colleagues across each of the platforms looking for your questions so they can put them to us. So we have one now. Actually, we have more than one now, but let me get at the first one. Mario Frontado is asking what is the possibility of some kind of a travel certificate or an immunity passport or some kind of certification that would in a way show that you have immunity. There's some questions around how effective that kind of a certificate is, and so WHO does have some advice around that.
Okay.
Yes, we do. I will ask Carmen to start,
take
and
that one.
Yeah.
we will have a teamwork, and I will
sure.
supplement as needed.
Yeah. Thank you very much. This is really a good question that we receive often. And as Nika was mentioning, we did have published a scientific brief highlighting the science behind the immunity of COVID-19, which says that for the moment, even if we are so late, despite the research that we have done, we still don't know exactly how the immunity develops after how many anticorps, what type of antibodies, what type of things, at what distance from being infected. So the science behind it, it's still being uncovered. That's why we do not recommend currently using an immunity certificate, as we say. And this immunity test would analyze your body or your blood type, blood to say if you got the disease, if you were already infected. And there are other types of tests that we are doing, of course, the ones that show whether you are infected or not. This is a diagnostic PCR test. And we know that some countries are asking this testing prior to departure. And also with this, in our recent guidance, we also mentioned that even if you had a test 2 days, 3 days, 4 days, 5 days before your travel, you still are at risk of being exposed between the moment that you took the test and the moment that you travel. So all of this testing, we really need to be to continue to follow the science, the development of the scientific knowledge around the immunity development, the fiability and the reliability of the tests that we are using, the extent to which we can use this test at the point of care, at the departure, in the airport, and so on. We are learning. We are in discussions with partners and with networks of people to build our understanding so that we can provide the evidence-based advice to travelers and to countries. I don't know if you want to supplement.
I think you covered really well all the public health aspects, but also we have concerns related to some human rights, data protection, and sort of use of those certificates. That's another reason. And the message I want to give is that we are following the scientific evidence and very carefully, and of course we will update as we have more information, but that's WHO's position at this point of time.
And if I may add one thing about it, because the question will probably come, or it did come again, the correlation with the yellow fever vaccination certificate, and also would like to use the opportunity to clarify this, that the yellow fever card is a proof that somebody has been vaccinated against yellow fever. It's not a proof of that person has developed immunity or not. And that's always the confusion between this immunity certificate and yellow fever vaccination certificate. For the moment, we don't have a vaccine for COVID-19, so the certification can only prove whether the person got the vaccine or not. It cannot show whether the person has developed immunity. And I just wanted to clarify this because there's always a confusion between these two types of certificates.
There's a few questions on when and where and how I should be tested and how many days and so on. Some of it is really dependent on what your national authorities ask of you. WHO provides guidance to governments, but then the governments will have their own recommendations as to when you should be tested or retested, how soon before travel you need to have taken your test. So some of those are not really on our plate to be able to answer. Some people are asking, this isn't exactly our specialization for this exact group, but around the quality of the air in an airplane. We recently did an update Q&A, question and answer, on air quality and on ventilation, and we did mention on airplanes. But Carmen, I think we were speaking about this just before as well. So people want to know, what's the quality of the air in an airplane, and can I get sick from the air in an airplane? So Carmen, over to you.
Thanks very much, Nika. Yes, indeed, we were just talking about that, and I mentioned we are in discussion with our partners in the aviation sector, and we know from them that many of the modern jets have a system of recirculating the air in the aircraft, and these jets which have the circulation of the air, they are provided with a HEPA filter that blocks certain small particles in that. And these are many of the modern jets, but there are some older planes that do not have this recirculation system in the plane, which do not have the HEPA filters, as we call them. So that's what we gain as knowledge from our partners in the aviation sector, and we continue to discuss with them to get more insights into the developments of the technology for all these aircraft.
I think, to summarize though what you had said off the top, the air in airplanes, simply put, is actually relatively clean, as it were, because it's filtered regularly in most airplanes that most people will be traveling on for international travel, which is what we're speaking about.
I think the concern people have is whether it is circulating the same air.
Yes.
And to our knowledge, even though it's not our technical expertise, of course, but we work very closely with the UN agencies and other partners in travel sector. And we have been assured that the new filters are not going to be circulating the same air, but it will go through the filters.
It filters the air before it comes through,
And then also we work very closely with them, and we advise on the public health measures, but also they take care of the infrastructure that is like at the airports, at the aircrafts, embarking, disembarking, luggage, and all these services are also assured that they are going to risk the minimum or decrease the risk to the minimum on transmitting the disease during travel.
We're asked a few questions are about what happens when I arrive in the destination country. What does WHO recommend in terms of testing and quarantining once you've landed where you're going? It's not your home country, it's your destination country.
Yeah. We know that some countries may ask you to do a test even upon arrival to make sure that you were not exposed during your travel or before your departure. And we know that some countries are asking travelers to either stay home or quarantine for 14 days. What we recommend as WHO is when countries decide to put in place quarantine measures, which we recommend for the contacts of cases, these measures should be following the certain guidance in terms of the type of facilities where the quarantine is instituted, the access to food, distancing, and so on and so forth. And we issued guidance about it. But travelers would need to inform themselves when they travel, because these measures are changing very frequently. As we mentioned before, the measures that countries are putting in place are based on risk assessment, and they look at the evolution of the epidemics in the countries of origin, in the countries of arrival, and so on. And the limitations or the restrictions are changing every day because of the changing and the evolution of the outbreak. So that's why people that decide to travel, they need to keep themselves abreast of all these changes in the list of countries, for example, from where the restrictions may be put in place and what type of restrictions they can secure, and plan their travel accordingly, so that if you are asked to stay home or in your hotel for 14 days, you plan your travel according to these measures.
And again, the message is be comprehensive and look into different strategies. And that's where WHO works, what we call points of entry. It's the airports, ground crossings, ports, and we try to strengthen their capacity to be able to detect a sick passenger immediately, define their contacts immediately. And also one important information WHO is suggesting is to provide all the details on what they have to do in the country that they're traveling to, if that's not their own country, to be able to refer to any medical services or provide the guidance. Another important, maybe very simple information is getting the passenger details. You know, what is the telephone number, where the person is staying, so that you can reach out in case you have additional information.
That's contact tracing, in effect. That's part of contact tracing, to see if one of these people was a contact, if something develops later.
In your portfolio, I mean, they're not contact yet, but if they become contact, so that you can approach them, because they're different than your nationals, because they're traveling, you need to know whether they stay in a certain place, so that you could approach immediately.
Yeah. There's a few questions asking very specific things. If a person is elderly and wants to travel for holidays, should they do it? If they're a student going into a country that perhaps has more transmission than their own country, should they travel? So again, we're talking about, it's a risk assessment and a personal choice and decision in a way. I know that Dr. Mike Ryan in the press conference has spoken a lot about that, that sometimes you're even allowed to do something because it's permitted by WHO's recommendations, by your own country, but again, you can still choose not to travel perhaps. You could be extra cautious because of your own situation. So it really comes to you as well to make those decisions. Where can people get information to make those decisions? Where's a good source of information for people, so that, because we won't be able to answer every question here, where do you recommend people go for even more information?
First of all, I think they have to really check the national policies, and they're all available in the reliable either Ministry of Health or the country's Public Health Institute websites. Some of the countries have their own recommendations for their own citizens to travel, or recommending to avoid travel. And again, the risk groups they define are different. But for us, for WHO, as we have told before, we believe the essential travel should continue. And then people who are sick or contacts of sick people should not travel. And then there's the prevention of all the high-risk group and elderly, and they have to go through a risk assessment. But our recommendation is to postpone or avoid if possible. If
you're in those risk groups. We also have, there's material on WHO's own website. If you go to who.int, there's information some of that information is available in all of the official UN languages. You can also go to the webpage of your regional office, or to the country page. WHO has offices in 150 countries, so you could see if there's a country page that has some detailed information in the local language for you. Also check our social media platforms wherever you're watching us from now. We have information there on what kind of mask to wear, how to wear a mask safely, some details on travel as well. We're going to be putting out some social media slides that summarize some of what we're saying today in very clear bullet points to help you understand that as well. There's a few questions here on once you arrive in the destination country, can a test, as you mentioned, Carmen, if you do a test there, can that substitute for the 14-day quarantine that some countries recommend? So is the test a substitute for a quarantine, is the question. We've gotten that a few different times.
As I mentioned, it really depends on the measures, on the decisions that countries have put in place. And it depends on the trust or confidence, rather, that the country have in the fiability of the tests themselves. So for the moment, as I said, we don't necessarily recommend one way or the other, as we want to understand more about the reliability of these tests, particularly the test at points of care and so on. But it all goes back to what you said of the individual information and choices and understanding of where they are going and understanding the measures that are in place. And just to go back to the other question, the other source of information, which is regularly updated because of obvious and practical reasons, is the airlines. And the airlines are regularly updating, even when you go to check if you need a visa for a certain country. There are certain services that are in place by our partners that provide the information whether in order to get a visa you need to have a test or you need to get a certain other vaccination, for example, for other diseases, because it's not only COVID happening in the world, but all of these requirements for travelers, there are places where people can go and get the information when they decide to travel, if they need to travel, as we keep saying from the beginning of this. We'd like people to avoid as much as possible non-essential travel.
But countries are doing that risk assessment. That's why the measure sometimes the countries exposed to travelers is different depending on where you're coming from. So in very simple terms, they feel like if the transmission is at the same level, so the traveler doesn't bring an additional risk. But if the traveler is coming from a more intense transmission area, then the risk of importation of cases are going to be much higher than what is available. So countries have different set of measures depending where the individual is traveling from. But again, our message is please do all together.
Yes.
Do not stick to only one measure.
It's, and that's for individuals as much as it is for countries as well, that countries should do it all. Countries should put in place the full toolbox of responses that we know work against COVID. The reason we know they work is countries that have implemented most of them or all of them have been successful in pushing the disease back. So it's do it all for countries and it's do it all for individuals
With
as
the
well.
intention to be able to detect any case among the travelers as soon as possible. It's the same as you would do with your nationals.
Yes.
Or define their contacts as soon as possible and quarantine them. And for the cases, isolate them and provide the care. And in order for the travel to not expose any additional risk, of course, what we emphasize is controlling the transmission in our countries, in the local setting. So once the transmission level comes low everywhere, it's going to not be posing an additional risk.
We're going to
Again, that requires compliance at the community level, at the individual level on the measures that WHO has been recommending.
So a question that's come up a few times now, and we're going to be wrapping up soon, but we want to make sure you get this one. So we mentioned the filtering. I know this is getting very technical, but people want to know. We mentioned that the airplanes have a filtration system, and people want to know what kind of filter is that. And actually, that is a detail that I've seen in our communication.
We said that they're called HEPA filters. I don't have off the top of my head what HEPA means, but it's something related to the particles and the way the filter
I think
operates.
it's high emission particles.
Yes, exactly, something like that.
See, I said it
They
wasn't
call it HEPA.
exactly our area of expertise, but it is HEPA, H-E-P-A, and if you want to, you can look that up and get more information. A few things. We're going to be wrapping up, but I just wanted to express our sympathies to the people in Lebanon and to the people in Beirut who were affected by that terrible blast. WHO is working on the ground to help, but I know it's a really difficult time, and all of us join in sending sympathies to people and colleagues from Lebanon. We actually have people watching from Lebanon today, as well as a few other countries I'll mention, Namibia, Kenya, Afghanistan, Bhutan, South Africa, Egypt, Uganda, Peru, Brazil, India, France, Macedonia, and so on. From wherever you're joining, we thank you very much for joining us. You must have very many, we know there are more questions than we were able to answer. We will be looking at what you put in the questions and comment section. Our colleagues who monitor social media actually come back to us and let us know what kind of questions are out there, and that helps develop what we're going to put out, what kind of answers or products we put out in order to make sure we're answering the most common questions that you might have. So I just wanted to thank you one more time for joining us today. Thank you, Dr. Carmen Dolea. Thank you, Dr. Nedret Emiroglu, for your time today.
Thank you, Nika,
thank you for putting together the products in the first place that we're doing this Facebook Live about. These were the originators of that guidance, working with all the other specialists that you mentioned as well in industry groups. So thank you once again, and thank you for joining us.
Thank you. Bye.
Bye-bye. Thank you.